Atypical primary hypoadrenocorticism is caused when there's a more gradual destruction of the adrenal cortex layers, and sometimes the zona fasciculata, which is the zone of the adrenal cortex that releases cortisol, decreases in activity before there's a loss of aldosterone. And so we see glucocorticoid deficiency alone and aldosterone presence, which results in a normal sodium and potassium ratio. The one thing to consider, and this is very important in an early study by Bart Peterson's group at the Animal Medical Center in New York City, is that the majority of cases develop a loss of aldosterone within days to weeks of diagnosis. And so in those patients where it wasn't routine to run the cortisol assays and ACTH stimulation tests on a daily basis, by the time the patients had their ACTH stimulation tests returned, those animals actually had become aldosterone deficient, and some of them had died of the results of hyperkalemia. And so it's important in these animals that you suspect having atypical primary hypoadrenocorticism. Those patients, I would consider running an ACTH level and monitoring their electrolytes very, very closely in weeks to a couple of months following induction of steroid therapy to make sure that they also don't need replacement of mineralocorticoids.